Welcome to the Menopausal Women's Show, Nutrition, Health and Wellness. I am Michelle, and as a menopause coach, I work with women to transform their hormone health and well-being to achieve the life they want to achieve. Now, on this podcast, I share research findings on hot topics, talk with other holistic healers, and share my own experiences to empower women to take steps to a better lifestyle. Now, this week, I am super excited to welcome Sally, who has been a reflexologist for 25 years, supporting many individuals to thrive through fertility, tots to teens, and more importantly, the menopause. Now, from my own experience, I've had reflexology to help with fertility issues, and I will forever be grateful for that experience. So without further ado, let's please put our hands together and welcome Sally to the show. So welcome, Sally.
Oh, well, thank you so much for the invite. I really appreciate it.
Welcome. So before we get started, I think let's just share with our listeners a bit about your journey and how you become sort of like a reflexologist. What led you to that?
Yeah, fine. I started my career as a nurse nearly 45 years ago, and I did a nursing degree at the time and carried out nursing, did a few staff nurses posts, and then went into a research position with Macmillan, looking at quality of life in advanced bowel cancer patients. So I stayed there for about 10 years and then got offered an opportunity to go and work at the King's Fund, which is about the health of Londoners, in their evidence-based medicine programme, which was all very, I know, yeah, it goes downhill from here, which was all very exciting at the time, but I just so missed that hands-on, at the time, patient contact. So I started looking around and you can imagine I had this quite scientific brain. And I thought, no, I'm going to try complementary therapy. And reflexology sort of made sense because it was touch, it was nerves, it was circulation. And I thought, I can cope with that. So I started as a reflexologist. If I'm honest, when I first qualified, I don't know that I truly believed in it. But it was working with women and hormones, as you've already shared, working in fertility, women who should not have got pregnant, who went on to conceive, working through maternity and seeing the change in symptoms during the pregnancy just blew me away. Menopause came a bit later, but that might be because of my journey. I've been working with that for about 15 years now. But I've had, I work for the Association of Reflexologists. I've taught the diploma. I now teach CPD. I was a secretary for the Reflexology in Europe network. I have had such an incredible career. And I have to say, I'm more excited today about reflexology than I ever have been before. I'm going to share a bit of the science that we have, but particularly with empowering women to be the best that we can be at that time.
So I have one burning question,
Oh
right?
no.
Which I know. So reflexology and my
Yeah.
experience is feet. Didn't you ever have like an aversion to feet, or have you always loved feet, or is it just something
Well,
you came to?
I've never had an aversion to feet. And actually now I really love feet. And yeah, I've never thought about it. But as a nurse, if you think about the sorts of things we were facing,
That's
actually
very true. That is very true.
working with feet is just not a problem. And actually nobody who comes into reflexology obviously has an issue with feet. Can be done elsewhere, but our initial training is on feet.
Which leads us into sort of like the first sort of thing for our listeners, which is, can you tell us a bit more about the science behind reflexology? How does it work? Where does
Yeah.
it all start?
Yeah. I mean, very simply, reflexology is a complementary therapy that is effective in promoting deep relaxation, which aids healing, and improving well-being. And that's our physical and our emotional well-being. It can be used alongside conventional medicine, and that does include with HRT as well. But sort of, I will go on to describe it, but in a nutshell, I think it's my favourite therapy to receive, I have to say. when I talk about it, I'm going to talk about it in two main aspects of it. And the first is the fact it's a touch therapy.
Mm.
And as you've said, most reflexologists in the UK anyway work on the feet. However, some therapists also train to do it on the hand, and I'm going to be sharing some hand techniques as we go on, the face, the ears, other extremities. For this podcast, I am just going to talk about feet because it's a mouthful otherwise, but the same applies to all of those extremities. And with reflexology, the first aspect is, the touch aspect. And what we do as reflexologists comes from the theory that areas on the feet relate to different areas in the body. And what we do is we work through those areas that we call reflexes, and we can use thumbs, we can use knuckles, either for point work or for massage moves. We can use fingers. And what we're doing as we go through is we're feeling for tension in these reflexes. And that can be a change of texture. It can sometimes feel like little grains of sand that we feel, or popping. Now, I'm going to ask you to bear with me on that one because I'm going to
Yeah.
come back to that. Oh, you
Okay.
had a question? No?
No,
No, no,
I'm
no.
super excited. I'm charged here.
So we work from a map, and reflexology, the first evidence we have of reflexology, of working the hands and feet, comes from over 4,000 years ago, Egypt, China.
Mm.
It was brought to the West by a medical doctor called Dr. William Fitzgerald. And he went and observed what the Native Americans were doing. And he came and built the first sort of map that we had, which just divided the foot into zones. But he was actually using techniques which included placing pegs on fingers and working with very deep pressure for pain relief. He even used it as an anaesthetic for some minor ear, nose and throat operations and tooth extractions. Now, I don't think we use it like that these days, but
Very interesting
no,
because the only thing
that's
I've used a peg for because it's usually because I've got a nosebleed and I haven't got time to just sit there. So I stick a peg on my nose to stem the bleeding.
well, that's sort of a more of a direct result. But so that's where we started with these zones. And then it sort of developed. So we developed these foot mats where you've got much more specific areas. Now, if you are interested, if you go onto the Association of Reflexologists website, they have interactive hand and foot maps. So you can
Okay.
see where everything sits. So as I say, what we do when we find these areas of tension, we'll be working it out, which we believe, and say we've got some evidence, that actually it will bring relief to the tension in that area in the body. I said I'd come back to this sort of foot mat because we are now actually getting evidence that there is this connection.
Oh, really?
And this was the first studies were done in Japan, and they were using functional MRI scans. And what they have shown is that there is a relationship between areas on the foot and the somatosensory area of the brain, which interprets touch. Very simply, one of the findings in this Japanese study is that if you press the eye reflex on the foot, it's the facial area of the brain that lights up. So this is really exciting for us that we're finding this connection.
Mm.
And there are currently a lot more studies going on in America to further sort of develop this work. So the first sort of part of reflexology is this touch. And we know there is an effect and we know it's deeply relaxing. The second part of reflexology is we are a holistic therapy. And I think one of the really important things is that we can provide a really safe, non-judgmental space. We can offer support, and I'm going to refer to women. Obviously, it would be the same for wherever you were seeing a reflexologist. But in terms of menopause, it's fantastic, isn't it, how the taboo subject is being talked about now. But individual women need to find their safe space at times where they can talk, and reflexology can offer that. And
Mm.
we can also offer some lifestyle support, or we can signpost over to experts as well. So it works on different levels. Everybody reacts differently. So the only way you really are going to know how you'll respond is to try it.
I think that's really quite important because obviously I'm a holistic practitioner as well, and the studies that we have to get us accredited is few and far between. We need more research to do that. I think for this, what menopausal symptoms have you found that reflexology has been most effective in managing the menopause?
Yeah. Well, we do actually have some research studies, which is quite unusual, as you're saying, not unusual, it's a growing field. It's very difficult to do research, especially with menopause when the symptoms are so wide.
Mm.
The studies we've got have shown that reflexology can reduce vasomotor symptoms, which is your hot flushes, your night sweats. It's been shown to improve quality of life, improve sleep duration. It's been shown to reduce depression scores. This is all within menopause. It's been shown to improve fatigue and anxiety. So
Now
there,
that's
yeah,
really,
it's
because
big.
obviously fatigue is for a number of reasons. It could be what you're eating. It could be that your joints. It could be because of the hot flushes.
Yeah,
And it could be lack of sleep. So you're saying fatigue,
yeah. So
and
that's where we've got the research studies. And I say that they're always going to ask the questions about the most common
mm,
symptoms. It is absolutely vast. I say everybody responds differently. I think this goes on to what you were just saying. What I have really noticed is the women that get the best improvements are those that do take on lifestyle changes as well.
yeah,
And even small changes can make a big difference. And I talk about the 5 pillars for healthy menopause, which of course includes relaxation, which will include reflexology. But we know that if you can reduce cortisol levels, you'll reduce symptoms. I talk about nutrition, which you will have covered in your podcast, obviously. Movement, you've talked about these, sleep. And then the fifth one I talk about is purpose. And I
mm,
think that's really important because when we hit menopause, it's a time where life is changing. Children may be leaving home, we may have lost parents, and it's a time, and I talk about this in a really positive way, it's a time for reframing ourselves.
100%,
Yeah,
100%.
yeah, we need to decide who we want to be for the rest of our lives and make a plan as to how we can get there.
I think that's really important. This is where we go back to this
Yeah,
holistic approach. Because for me, certainly for me, I'm a very busy woman, but you play so many different roles. And
yeah,
all of a sudden, you're whacked with a whole load of different stuff that you have never, it's not in any textbook, right? So
yeah,
it's not like, right, you're going to be born, you're going to have this at your 20s, this at your 30s. And by the way, by the time you get to your 50s and 60s, this is what you're going to feel like, and this is what you need to do.
yeah,
And I
with no
tend to
manual.
find, no. And this to me has been a real junction of going, okay, so you've got a heck of a lot to deal with. Where do you want to go? Because now is that junction of what it is between now and when you depart this world and this body.
Absolutely.
And there's lots of emotions going there. It was interesting you've talked about cortisol levels because again, I think a lot of very sort of like early menopausal, perimenopausal, you're in high-powered jobs, you're managing your children, plus you're working, plus like then you're trying to have your own like world. And I can guarantee you, okay, you will either have had some sort of small T trauma or big T trauma. And when I say small or big, it depends on which way. It could be that obviously you've lost of a loved one or
Yeah,
a divorce. For me, one of my big T traumas was being an abused child, and coming from nothing. And all of that has impact on your
Absolutely.
body and your emotions. So actually having that balance where you go, well, actually, it isn't just the menopause symptoms, it's the whole host that makes those menopause symptoms either worse, or some people don't actually find that they've got a symptom. So like some people will
Absolutely.
become allergic to alcohol. I know that I'm not one of them, but I've become more intolerant to other stuff.
Yeah. I have to say on that note, I became intolerant to red wine, but it's gone and I'm back again. So
There we
it
go.
does pass.
It does pass. Excellent. That's a good news for
Yeah.
people, because certainly it has some health benefits. So like I think reflexology kind of like, what longer term benefits? So like
Yeah.
I can come to you and I go, right, at the moment, I'm really anxious. I've got Christmas coming around the corner. I've got my kids, banging on my door telling
Yeah.
me that they've just found their shoe, and I'm going, I am working. Thank you very much. You're trying to manage all of this stuff. And yet I could come to you and go, okay, can you just fix me?
Yeah.
Okay, I've made all these other changes as well. Can you just fix me? Is there any longer term benefits that you've seen by just having, say, a sort of course with yourself, that then you have found that if they come back for a top up, that actually is not as bad as the first time? What sort of longer term benefits is there?
Yeah, and there's lots of ways sort of to approach this. We've got no evidence on long-term benefit in menopause at all. I think one thing I just want to perhaps highlight here though in menopause is no, I'm going to start somewhere else. So you come to me, some clients do come, they are having an incredibly high stress event at that time. They will come for 4 to 6 treatments and they will wander away again and then may come back if they need to. Most clients that I see though then do stay with me and have monthly, sometimes every 5 weeks, treatments, almost like maintenance. And if I then turn that into the menopause, I think one of the things that's really interesting at the moment is all this talk of menopause is amazing, it's fantastic, but the focus is on perimenopause.
Mm.
Perimenopause lasts on average 4 years. It's a turbulent 4 years. Your hormones are all over the place. But then if we think about postmenopause, so you hit menopause, not had a period for 12 months, you live the rest of your life in postmenopause, which could be a third to a half of your life.
Mm.
And actually, this is very different. This is where women's health becomes really, really vulnerable. And it's about long-term conditions.
Yeah,
And
absolutely.
we're at higher risk. If you look at the risk of a cardiac event after menopause, it just rockets. We know that women live longer than men,
Mm.
but we have more unhealthy years, which breaks my heart. And I'm sure a lot of that fits in to this postmenopause. And so postmenopause is something we really need to start fitting into that healthy aging agenda. It goes back to that holistic approach, to our 5 pillars, to the self-care that you talked about. And even with the self-care, it slightly worries me because it's being bandied about all over the time, all over the place. And I'm sort of worried that people are just going to get bored of it and think, oh, there's that word again. But actually, longer term, postmenopause, it is a time we have to prioritise our health.
And
And
that's
actually,
really important.
reflexology is one of those things that I said right at the beginning for improving well-being, both physical and emotional. So having a regular sort of monthly session, I think can be invaluable for many, many reasons.
And I think this is quite interesting, and just to digress a bit, because self-care, as you say, the first thing people think about is spa days, right, and bubble baths. And and I'm going, actually, it's
No,
not. And it could be as small as turning off your phone or put a
yeah,
do not disturb. It could be actually you just taking a walk and some time out. Or
absolutely.
having a nap, because I came home from my day out and I was knackered and kids jumped on me. I was really irritable and I was like, I just can't deal with you now. I need to go and have a nap.
Yeah,
And equally, self-care, like I know some people think it's about getting your nails done, but it's trying to find out what works for you and then thinking about where's that investment. And when I
yeah,
say investment, can you afford, to invest, which has longer term benefits, the reflexology, because that is a longer term effect. Where your nails, you get done, it's self-care, but you've got to get them done again, in a few
absolutely.
weeks' time, or they're chipped after the first time you've had them done. Which I'm not saying anything against getting your nails done, because it does help you with your body image and your
Yeah,
confidence. I'm just thinking the investment, if money is tight or an issue, then where do you put that investment? And that could be a combination of actually a few free tweaks that we can all go through, or just buying a journal,
yeah,
for sort of like £5, and that lasts you for a good few weeks, or it could be that investment for the longer term. And I think for today is really just like opening up and asking people to just take a pause. We're starting to go through how reflexology can support on those menopausal symptoms, which can be deliberating for many women and has a whole
absolutely.
host of benefits. And actually then going, what's more important to you, the longevity and the sustainability, or
Yeah,
something that will just be, and you could have a combination of both. You could.
absolutely. And, support yourself with hand reflexology. And I think that's one of the shifts I see is that women will often come and think, oh, this is a real treat, and feel slightly guilty about spending the money. They could have one night out for the same price, we're not talking several nights out. But their mindset shifts to that appreciation that this is about their health, actually. It's not a luxury, it can become part of their health package.
Yeah.
And I agree with you. I say to all women, try and build in 10 minutes a day for an activity, can be 7, but 10 as a minimum takes you out of your head and into your body. And as you say, people say, oh, I relax by scrolling through my phone or watching TV. It doesn't stop that mind chatter. You
No.
need to come back into your body.
100%. Now you mentioned about doing some techniques, and that's
Yeah,
what. Are there any self-care reflexology techniques that women can do to support at home themselves that could just get them started off?
yeah,
And I think the importance here is actually, from my own experience, be open to give reflexology a try, because again,
absolutely.
I didn't know anything about it. I'd
Yeah,
come off the pill thinking, oh, I'll come off the pill, you get a period, you can get pregnant. 3 years later, I
yeah.
got my first child. And so it can be quite intense, because obviously the medicine affects the way your body is. But just for people that want to delve in and just, think, well, is it something I want to give a try? What can you share with us today?
So I'm going to share with you 3 really, really simple techniques. If you want more, go back Association of Reflexologists website and click on their YouTube channel, and there are loads
Oh,
of
wow.
self-help hand reflexology.
I will put their link in the show
Yeah,
notes to make it
brilliant,
for the
brilliant.
people.
The 3 that I'm going to show, because it's a podcast, we're obviously slightly limited, is the first one is for anxiety.
Okay.
And it's one of those things when you are feeling really stressed. I may have been doing this just before I came on the podcast. It's called solar plexus breathing.
Okay.
And what you do is if you squid your hand, cup your hand
All right.
with your other, and there's a dip right in the center of your hand.
Yeah.
With your other thumb, just place your thumb in the center of your palm. And then what you do is you take a deep breath in through your nose, count for 3, push in and turn on that central spot. Breathe out through your mouth and relax. And you do that 3 times on each hand. So push in, turn, release the pressure as you breathe out through your mouth. So that, as I say, 3 times on each hand. Now this technique is so good because you can do it anywhere as well. So if you're on a bus going to an interview or a stressful situation, rather than having your palm up in the air, just have your hand downwards
Done.
and you just literally rest your thumb in. Nobody can see what you're doing. And then just do your breath silently rather than huffing and puffing in and out. So it's a really, really useful technique. I can't tell you how much I use that.
I've got to say thank you for sharing that, and hopefully the listeners will be able to get, if not, head over to the
Yes,
YouTube channel and you can see.
absolutely.
And the reason I say that is the amount of women that are perhaps in a corporate job,
Yeah,
okay, and the anxiety gets in, they've got to have a difficult conversation, or
absolutely.
and you go, actually, that's really, really useful.
Yeah,
And even sometimes for me, it's like I'm going to a new place. And though I've mapped out everything and where I'm going and what I'm doing, it's like, oh,
yeah.
hang on a minute, something might change. And then you go in, right, instead of panicking,
Absolutely. I cannot
just do
recommend
that.
it enough. You know, if you're in the middle of a meeting, you can do it under the table. It literally can be done anywhere. And you just do your breaths very silently, and it just allows that brain to pause as well. So that's number 1. Do you want a
Okay.
couple more?
Yeah, we can do a couple more.
The next one is the adrenal reflex, which is really important. Adrenals produce your stress hormones, your adrenaline, your cortisol. But also your adrenals continue to produce a very weak form of estrogen, even during menopause. So a really useful one to work. And if you hold your hand up between your thumb and your first finger, there's a V-shaped
Shape.
soft pad.
Yeah.
Yeah. And what you do is you squidge your finger and thumb either side of that soft pad, move it right the way down to that pointy bit of the V, so as far into the V as you can get,
So are we moving it towards the finger or moving it towards the thumb?
moving it so it's right in between the finger and the thumb at the
Right.
base of
Okay.
that flesh
Yeah.
in between.
Yeah.
You squeeze and you turn. It should be tender. If
Yeah.
it's not tender, move around till you find the tender spot. Um, and that's what Eunice Ingham's mother of reflexology says, find the sore spot, work it out. And you literally thumb and finger either side, top and bottom, rotate them. Just squeeze if that's easier.
Squeeze.
Both hands.
Ooh.
So
Okay.
hopefully they're simple enough that you can understand what I mean.
No, I think, as I said, do head over to the YouTube, but
Yeah, yeah,
100% I can feel that. And
yeah,
it's the same old adage. Obviously, my fault is being an athlete, but you know, it's the pressure points. It's where does
yeah.
that little niggle? Everybody knows what a niggle is in the, when you're stressing, you're holding it into your shoulders. So it's kind of like, we'll go and find the niggle point on that one and just
Absolutely.
and massage it.
Yeah, yeah, exactly the same. And then the last one I'm just going to share is the lymphatics, which is about inflammation. That's why I'm really keen on this in menopause, but it's inflammation and immunity as well. So it's a good thing to be doing anyway. And all you are doing is you're working on the top of the hand for this. It's quite nice if you apply a bit of cream. And it's at the base of the fingers, it's actually on the main part of the hand, and you are just rubbing up and down, or you can walk if you don't have cream, in between those bones of the hand. And you just take it across in between the fingers, walking down towards the wrist. And again, try and work so you can actually feel it. You can rub backwards and forwards if you prefer. And what I'm going to say is the solar plexus is really good as an emergency sort of, I'm feeling stressed. But try and do all three. Spend a few minutes each day on each hand, and that's your out of your head and body experience as well. That counts towards your relaxation as well. So a
Mm.
few minutes on each hand. Decide when you're going to do it. Do you always have a morning cup of tea or something and think, I'm going to do it when I have that cuppa? So
Or when you're on the
decide the
train, if you're
time.
a commuter and you're using the train, that's probably an ideal
Absolutely.
point.
Absolutely.
I wouldn't recommend driving, please. Two hands on the wheel.
No, probably
Yeah.
not.
So that's really useful. Thank you for sharing that. I think if we just to backtrack, so kind of like we've gone, it can help with the well-being, the
Yeah.
anxiety, some of the common symptoms. And again, like with anything, it has to be a holistic approach. If somebody is going, actually, I really want to kind of delve a bit more into this, from your experience with your clients, I usually tend to find, or from my experience, and do correct me if I'm wrong, after the first one, I feel okay, a lot better. But how much should we have on the treatments to start us off to really notice a difference?
I mean, in general terms with reflexology, we say to a client, try and commit to 4 to 6 sessions. And I'll talk about frequency as well. But with menopause, we see changes really quickly. So I
Mm.
will say to my client, commit to 3 or 4 sessions, and we will know by then if this is going to be the approach for you. Now, in an ideal world, they would have a treatment a week apart.
A week apart.
Not always an ideal world. So, what I will say to a client is just try and get those first 3 appointments in as quickly as you can.
Mm.
We can then give them hand reflexology to support them if they can only come a fortnight or once a month. But obviously, the closer together you have the treatments, the quicker you're going to see the
Yeah.
changes. But I do see changes really quickly. You have clients who I had somebody who came for, she'd been given a gift voucher. So she came just for one treatment, didn't even tell me she was having menopausal symptoms, and then contacted me a week later and said, my hot flushes have gone.
Oh, wow.
So she's now been with me, I think, for about the last 6 years. She comes once a month. No, but we don't promise that one quick fix. We say
No.
try and commit to three, at least 3 or 4, see how you go, and then we will reassess with the aim to pacing it out so it's a monthly treatment.
And I seem to be in a different world at this moment in time because I'm plugging more of, if people want ideas, because I know that my husband is rubbish when it comes to Christmas.
It is,
Um,
yes, it's Christmas time.
it's coming up to the festive seasons, the holiday, we've already, some of us started Diwali, is coming up. You've got Thanksgiving. And
Yeah,
actually, I'm starting to say to people, if you're listening to this, just make a note. I think, well, if you're not too sure, why don't you ask for a gift voucher and give it a try?
yeah,
Which is amazing because obviously I'll include your location and your website. You're based in London, but we do have people sort of worldwide that listen to this podcast. So how can somebody find a reflexologist near them and what are they
yeah.
looking out for? Because again, something that's quite close to my heart, and we can liken it to the supplement industry, the amount of people that will brand supplements as brilliant and groundbreaking when actually you dive into it and it's probably not the most best quality. So if we're looking and we can't get to you, what type of thing are we looking for when we want to go and engage reflexology?
And actually, it's a really good analogy with the vitamins. Reflexology isn't a regulated qualification. There are very, very few, as you will well know as well, as a nutritionist, very few regulated professions. They're the ones that tend to or have the ability to cause harm. It's your doctors, your nurses. So it does mean that a reflexologist could mean anything. And you want to look for somebody who is properly trained. And another plug, I would suggest you go to the associate, if you live in the UK, Go to the Association of Reflexologists website, because you know all of their members, and it's the largest reflexology association in the UK. But you know all of their members are properly trained. They hold a regulated, nationally recognised qualification or equivalent. They're insured. They are dedicated to continuing professional development, and they are bound by a code of conduct. So you know you are safe in their hands. What you do is you go on the website, find a reflexologist, and you pop in your postcode.
Okay.
And it will bring up the list. And I then suggest you speak to 2 or 3 of them, because it's not just about the reflexologist, it's also that therapeutic relationship. You need to know that the person that you're going to see, you know, if you like somebody who's very soft and gentle, that's one thing. If you want somebody who's, you know, a bit vivacious or out there, you need to know that that relationship is going to work. Speak to a few of them and check that they're going to suit your needs.
That's really good advice.
If you're international, I would say look for the biggest association in your country, and hopefully they will have a similar facility as well.
Which I know I've got a few people that listen from the States and Europe. So
Yeah.
and definitely sort of like all of what I do promote is accessible, obviously online for me. But there are other agencies out there that, you know, will have that thing, because it's rising. It certainly holistic health is rising.
Absolutely.
I think just before we close up, because I found this has been very informative and useful, and I thank you.
Good.
Is there anything that you want to share, like kind of like that burning that we haven't covered, that you go, do you know something I really want to share with you and your listeners about reflexology and menopause?
No, I mean, I think it's probably been covered, but if, you know, my takeaways really are that reframing, you know, really take time to be selfish, put yourself first, and consider who you want to be for the rest of your life, and make that plan as to how you're going to get there. Don't make it all consuming, make it little changes. You'll do this with your coaching work. Make it achievable, because if you say, right, I'm going to run a marathon, I'm going to eat only plant-based, do this, you'll fail at one, your motivation decreases, you'll do none. Choose one small thing, look at those 5 pillars, think, where could I make some improvements, and make a small change. You make one small change, it's going to increase your motivation.
No, 100%.
And then the second thing is, don't underestimate relaxation, and give reflexology a try. What have you got to lose?
That's beautiful. So for everybody that's listening and watching on YouTube, thank you so much for coming on to the show, Sally. And I have learned a lot, as I've said, and I know now a few techniques to enhance my own journey.
Good.
I will obviously include all your notes and details in the show notes.
Brilliant.
And for everybody listening, if you would like to connect with me to discover how my program can support you in conjunction with some of the other holistic therapies, then please head over to my website, book your free discovery calls, subscribe to my website. You'll get a free ebook, which can just give you some pointers like today has, on how to start your menopausal journey. And so I thank everybody for listening and watching. If you've enjoyed the show, please make sure you subscribe and leave us a review, because it helps me and others to get the podcast out there. So don't forget to follow me on LinkedIn. And until next time, stay well, stay inspired, and make sure that you do take that reflective moment and the tiny baby steps towards a healthier, happier you.